Hey, are you suffering from low back discomfort and you think your low back is the problem? My name is Dr. Derek Nielsen. I'm owner of Kaizen Physical Therapy. And today I want to give you the 4 biggest misconceptions that I hear from patients who come to me with low back discomfort seeking a solution. Number 1 is yes, the low back is usually not the problem. Or it's at least not the problem outside of discomfort. So if we want to get to a short-term solution, we have to work on discomfort or where the area that hurts. If we want to get to a long-term solution, we have to look at full body movement. What I mean by that is I see patients all the time that their upper back's not moving like it should or their hips aren't moving like it should. What I mean by that is the area of discomfort is often hurting because it's overworked. And it's overworked because somewhere else isn't working like it should. So if the hips aren't moving like they should, the low back has to move more. And when it moves more, it says, hey, ow, we need to do something else. We're overworked, and our sign or our signal to you that we're overworked is we hurt. So you gotta look at full body movement and make sure that everything's moving like it should, participating like it should. And it usually comes down to one of two things. It's either a mobility problem or there's a little bit of a core stability problem that you have to work on. Okay, common misconception number 2 is your diagnosis may not be the problem. So I see all the time patients come in and say, I've been diagnosed with arthritis, degenerative disc disease, even spinal stenosis or herniated disc. Okay, now a lot of times those diagnoses are not the cause of the discomfort. Recent research has shown us that 80% of people that age 50 years and older have degenerative disc disease, yet they have no discomfort. They're not complaining of any type of symptoms, but they have these diagnoses. Now remember, even though you've been diagnosed with this stuff, possibly, you can't see discomfort, you can't see pain, you can't see that stuff on an X-ray or an MRI. We're making the correlation from what we see on an image to what you feel. Okay, so you can't see that stuff. Usually it comes down to a movement problem, like I said in the first common misconception. So before you rush to even getting an X-ray or MRI or possibly going into surgery, make sure you exhaust all other options first. Okay, common misconception number 3 is the intervention is not near as important as getting the correct diagnosis, which really is the overarching theme of this video is we've got to make sure we get the correct diagnosis. Okay, so even, I have patients that come to me for physical therapy, but they'll say, hey, I want dry needling, myofascial release, or some people, I want massage, I want acupuncture. It's not near as important of what intervention you get as it is about making sure we get the actual problem, know what the real problem is, which really is the overarching theme of this video is we've got to know what the problem is before we can even find a solution. Listen, my goal, my mission is to save 10,000 people from unnecessary surgery, and back surgery is one of the most common surgeries that is done that is unnecessary. And that's because the diagnosis is just wrong. Even though you find these things that look scary on an X-ray or an MRI, they're usually not the problem. So that leads me into the 4th biggest misconception is rest. A lot of people will be given, they'll go to their MD and be given either pain meds, muscle relaxers, or anti-inflammatories and told to rest. Rest is a problem. We don't want to rest. In order for our bodies to heal, we need to move. Now, the caveat to that is that we need to move in a pain-free manner. So that could be something as simple as walking or some light yoga, but something that doesn't hurt, but you can continue doing it. That's going to lead to a quicker resolve to the symptoms and the discomfort. Okay, if you benefited from this video or if you think somebody else needs to see it, please tag them in this or share this out. Again, my mission is to save 10,000 people from unnecessary surgery, and you can help with that by just sharing this message. All right, thank you so much.